So now, in terms of keeping our program moving, I'm going to hand things off to AFTD's Scientific Director, Deb Niehoff, who will introduce our next session.
Thank you, Sharon. Following an FTD diagnosis, assembling a care team is crucial, but that's a step that can also feel overwhelming. Today, we have Dr. Allison Lindauer and Dr. Maya Lichtenstein here to provide some guidance. Dr. Lindauer is an assistant professor at Oregon Health and Science University and recently received the 2020 Wellbeing in FTD pilot grant from AFTD. Dr. Lichtenstein, a former AFTD postdoctoral fellow, is a behavioral neurologist as well as the Associate Director of Research at Geisinger Medical Center in Wilkes-Barre, Pennsylvania. Welcome to both of you.
Thank you.
Thank you very much. So we're going to be with you until 1 o'clock. So I'm Maya and Allison. We're going to kind of split our time and we're going to talk to you and hopefully have time for lots of questions as well. This is really about building a care team in your community. And if we want to go to the next slide, hopefully it'll work. I'm not very technological, so I'm having Allison take the brunt of all of this. So I just want to say, just first and foremost, each of us receive some funding, some grant funding, but it doesn't interfere with what we're going to talk about with you today. And we want to welcome you all. And because it's a virtual platform, which is always a little bit more awkward because we can't see each other directly. But we want to welcome you all and thank you for being part of this session. This is really just, we know that FTD syndromes, whether you have a diagnosis of a more behavioral variant or a language variant, or some combination of both, do require a team approach. And this helps to promote the health and well-being of families. And we're just going to take a moment to talk about who should be on your team. There are a lot of different people or groups of people who you may want to have on your team or may not have even been aware that you need it on your team. And we're going to talk about each of these kind of types of people or groups, what they do actually and what they're for, and how they might benefit you, depending on where your needs are at this point. We have actually a poll right now. So Doug, if you want to put up the poll, hopefully.
Yep.
Okay, so right now, looking at these choices below, can you answer for us who's on your team for your FTD diagnosis? And then we should be able to start seeing results. And we'll just give it a minute for everybody to answer. And of course, you may have very many people or more than one of these.
And Maya, I can feed a little bit more information if you want to go to the next slide, and I can tell you in a minute how it turned out.
Thank you, Allison.
Sure.
It was taxing for me. So first, neurology. I am a behavioral neurologist, and behavioral neurology, when you think about neurology, is sort of a broad category of providers who can see anything from back pain to stroke to headaches. So you ideally have a neurologist who has some either interest or special training, or a neurology provider who has interest or special training in what we call behavioral neurology or neuropsychiatry, or geriatrics sometimes too. So people who have have a tendency there's a lot of times in neurology a tendency to overlook or maybe not be as aware of or as sensitive to subtle changes in behavior or language that people with FTD may present with. What neurologists and neurology providers in this kind of field, they're medical doctors, and they help to formulate a diagnosis. And this is done through blood work and labs, imaging often, like either an MRI or CT scan. Some people undergo spinal tap testing or EEGs to rule out other types of conditions, or they will sort of do a whole workup. And this also, of course, involves not just all the lab and imaging stuff, but a really detailed history, both from a person who is having some symptoms and hopefully also a friend or family member who can speak for them too, to see what they've noticed and if there's any discrepancies, which there can be. Oftentimes the neurologist will help to identify the disease stage, so where you're at in terms of the progression, and kind of help to show, based on what your symptoms are and what the disease is, what you might expect going forward. So some prognostic implications as well. Then your neurologist should hopefully also be referring you to some community services and assist with some of the medications that can be helpful for some of the symptoms. We don't have a cure, obviously, not obviously, we'd like to one day for FTD and for other neurodegenerative conditions, but there are a lot of medications that can help with some of the symptoms that come up. And so the neurologist can help with that as well.
Thanks. And before we go on, I just wanted to let you know that the top 3 team members are family and friends, neurologist, and primary care provider. The bottom 3 are a therapist, like a psychological therapist, a rehab specialist, or palliative care. Thanks, everybody.
Thank you. So what are neuropsychologists? Neuropsychologists are often also part of the team that might help to diagnose the condition. Neuropsychologists are PhD or PsyD, so they are psychologists who have specialized training in neurocognitive testing. And the neurocognitive testing looks at all different aspects of thinking, including processing speed, attention, working memory, language skills, memory, regular memory, and executive functioning, which is planning and organizing, that kind of thinking, as well as visual spatial processing. Based on the pattern of things, we know that certain conditions have certain types of problems in certain areas, and their testing can oftentimes help to either detect subtle things that are hard to detect on our regular testing that we do in clinic, but also to help with teasing out the patterns of impairments. So they help with the diagnosis, and they can also help define the stages of disease as well. And they can definitely also help. Sometimes some neuropsychologists do provide some additional counseling and cognitive rehab to help preserve cognition and behavioral wellness. So they have a kind of, they're often helpful in the diagnosis aspect, but they can also help with some of the rehab stuff too. Next slide, please. Primary care doctors, we all probably know them and have them and hopefully love them. The primary care doctor is a gatekeeper. So they can be an internal medicine, family medicine. Sometimes people have a geriatrician, which is an internal medicine doctor who specializes in taking care of older people, usually over, we don't think of it as being old anymore, but 65 and older. These can be physician's assistants or nurse practitioners too. They manage your overall health, not just the frontotemporal dementia that you may be diagnosed with, but also all your other medical conditions as well, and help with medication management and referrals. They are usually people who have been involved, I mean, ideally, people who have been involved in your care for a long time and know you and your family quite well. So they are people that a lot of my patients I know feel very comfortable, and they want to talk things over with their primary care doctor. And they want to sort of, and that person is that provider is someone who's really kind of making those referrals and making sure that all of the specialists that the person might see it's all kind of coordinated in one place. So kind of the gatekeeper in a way. And they can provide a lot of insight for us too, as newer people coming onto the scene. Primary care doctors can provide a lot of background and stuff as well. So they're very helpful in coordinating care. And elder law attorneys, we're getting out of the medical field for a minute. You're thinking, what is the legal stuff doing in here? Elder law attorneys actually are attorneys with special training in legal issues, aging, and health. They can help with all kinds of things that you may not be thinking about as you're going to your doctor and getting a diagnosis for a medical condition. But with FTD and other neurodegenerative diseases in general, you want to be thinking as soon as you're sort of done with the sort of getting the diagnosis and figuring out what's going on, how can I help to sort of protect myself and make sure all of my wishes are what are sort of legally protected, and that they can help with powers of attorney. They can help with living wills. With disability, with FTD, for example, a lot of people are working age when they get diagnosed, and they can help with disability and sort of retroactively help for you to get that so that you are getting money from being disabled. They can help with financial and estate planning, and also they provide and can do an excellent job of some community resource referrals as well to help get people in home and any help at home that you might need. These are things that you might be getting from different providers as well, but elder law attorneys are also quite connected with the community. And I think Allison,
we have a question actually, Maya, and I think you're probably the best person to answer this.
Sure.
How can we be advocates to get the right diagnosis as soon as possible? My experience was that because of a mood disorder diagnosis initially, many specialists dismissed my husband's symptoms, so his FTD ALS diagnosis only happened 3 months before he died, though I pursued specialists.
FTD is particularly challenging. I mean, we know that there is oftentimes a 4 to 5 year gap between when families first seek care for the diagnosis and when they ultimately get it. Advocating, and you being an advocate is great. And oftentimes what ends up happening, I mean, I don't know exactly the situation, but being seen by a specialized, not just a neurologist, which seems already specialized, but seeing a behavioral neurologist. And if that person is still not, you're not feeling like you're getting your needs met, being seen at a center or getting a referral to a specialized center. For example, in our area in Philadelphia, there's the Penn FTD Center, and getting a second opinion from someone who this is what they do and see. And of course, at the time, you may not be aware of the condition FTD, so you might not know what you're looking for, but you need an FTD center specifically. And that can obviously become challenging too. But asking your doctors, even if you think they're lovely people, no one's offended at all if you need or feel like you need a second opinion or somewhere in a more specialized center. I hope that answers the question.
And a neuropsychologist may be really helpful in teasing out what's behavioral, what's psychiatric.
Yeah, and there are some limitations also with neuropsych testing. I know in my own family, my stepmother had FTD, and she had normal neuropsychological testing for a number of years, even though she had a lot of behavioral changes. But it wasn't captured on the testing because it was behavioral changes and she presented quite well. So it can be, but yes, getting all of the keep digging and don't worry about feeling pushy. This is for the health and the well-being of your family, your loved ones. So it can feel uncomfortable though if you're up against the medical community saying I think it's this.
Yeah. And I really think it speaks to the power of connecting with people and the communities such as the AFTD give you that. The problem is you noted that you didn't know the diagnosis, so you can't connect until you know what you're dealing with. And that's why I really encourage people to keep seeking. So my name's Allison Lindauer. I'm a nurse practitioner and a scientist at Oregon Health and Sciences. I'm going to just briefly talk about a couple other people that could be on your team. I hope that you will continue to put messages in the chat box. We want to keep this a little bit informal so we really can address your needs. This is not so much about us talking, but about us communicating with you so that you get what you need out of the next 15 minutes. So if you haven't met up with a social worker yet, that's always a great idea. Social workers and actually psychologists have a wealth of resources and support that oftentimes we're not even aware of what they can offer us until we meet up with them. But things like the very basics like financial issues and housing issues, but also mental health counseling and support for both families and the person with FTD. Sometimes what I tell the patients I work with is, I want you to call the social worker. You don't really have to have a great reason. You can just say, Allison told me to call you. I'm not sure why I'm calling you. And the social worker or a good psychologist will take it from there. A lot of you, about 18 to 20% of you have tapped into our wonderful rehabilitation specialists. It'd be great to get more of you too, because these people are really special. And a good rehab specialist, a good physical therapist, art therapist will really work with you to maximize the health of your family, not just the person who has the condition, but you as well. And a good rehab specialist will work with you as a team to just help you for everything from, can I get a better spoon so my family member can eat a little bit better, to help me create a communication book so my person we can communicate better, or how do I use this app so we can actually work together. So ask your primary care provider or your neurologist for a referral to a rehab specialist. And hopefully you and your PCP can decide which rehab specialist might be the best fit to start out with. I like them all, see them all. Even our speech therapists can help with cognitive rehab.
And question.
Yeah.
So may I ask
best?
you, what is the best way to connect with a social worker?
I love it. So in my practice, we refer to a social worker. And my apologies, I'm not that well prepared, but I'm sure there's an organization of social workers that can help you find a social worker. And I bet you the AFTD can help with that as well. Basically, we just put referral in.
Yeah, so in our clinic too. So because we are a memory clinic and we have a social worker sort of embedded with our clinic, we make those referrals all the time. But if you're in a situation where you don't have you're maybe seeing just your primary care doctor or your neurologist, you definitely can ask those people if they have a social worker that they work with to see if there's any services or any kind of counseling or anything that he or she could be doing.
Definitely. Yeah.
So or there might be, as Allison was saying, some sites of sort of general kind of the general sort of social workers out there who it would be helpful if they were someone who knew about neurodegenerative diseases and diseases like FTD and could meet you at your needs. So that there are different types of social workers. Some do more counseling, some do more community resources, some do a combination of both. But I would definitely talk with your doctor, and whether it's your neurologist or your primary care, you can start there. And they can also do some of the legwork for you to find a social worker.
And I see this next question that's come up. Should you continue to see a neurologist once diagnosed and placed in a nursing home? A doctor is available on site, but no neurologist. I'm going to click to the next slide. So those of you who'd like to read it can go ahead and read it while I address this question. I'm biased. As a nurse practitioner that specializes in dementia, I think we're really critical to the team, for the nursing home team, not only to support your family member in this transition or in living in a facility, but I find, and you might have the same experience, that the nursing facility team also needs support. They don't always understand what FTD is. And they may think of it as kind of traditional Alzheimer's and not really be prepared to appreciate how it's different. So I think the nursing home specialists really do need us. What I do is I will do a lot of phone consult and video consult. I wouldn't necessarily visit my patient in the facility, but I would definitely be in very close touch.
Yeah, and we do that too. And certainly most nursing homes will provide transport for the family member who's living in the nursing home to appointments. They can also arrange to do the telemedicine appointments. If some providers do go to nursing homes, but they're oftentimes not your neurologist or your neurology provider. So, but they can definitely still help you to have your family member who is living in the nursing home to come to appointments with their specialist. So whether that's through telemed or in person, but I would definitely recommend it. Again, yeah, and I agree with Allison completely. We provide a lot of help for the nursing home staff and education for them too, so they can better take care of people who have FTD.
I'm going to pop on to the next slide. If one of you could respond to this question, how do you find an FTD specialist? Maybe put a link in the chat box so folks can have good resources for how to find a specialist. And while you're doing that, I'm going to talk for a minute about palliative care and hospice. Do not forget that this is a benefit. Hospice is a benefit that you can use in the last 6 months of life. So usually what happens if a person is losing a lot of weight or is no longer able to eat or is no longer able to walk, they often will meet the criteria for hospice. And this is where a social worker can be extremely helpful in helping you identify, is my family member ready for hospice? The hospice services really do help you with those end-of-life transitions. And everybody wants a natural, most people want a natural and comfortable death, and this is where hospice will help you. Within hospice and palliative care, there are rehab specialists, clergy, and again, the end-of-life care. I'm going to keep going. They've given us an extra 5 minutes, so we have till 1:05. So I'm going to keep going, but keep sending in your questions. I love the fact that most of you said family and friends are on your team. I think that's really important. And this slide just kind of honors them. These are the people you don't have to explain what the disease is. These are your support group people, your religious organization, the waitress at Denny's that always knows you and can put up with what's going on with your family and cares for you no matter what. The post office, the dog walker. Remember, the AFTD also provides this card. You can print these out so that when you do go out and you're a little nervous about going out in the community with your family member, this helps paves the way, because it is important to get out and be in the world and not isolate. Also remember that your friends, oftentimes friends and family want to help, but they really don't know how. And they're like, okay, just let me know if you need anything, which isn't very helpful to you because you're probably, I don't know, I need everything. So write out a list, print it out on your computer. Anytime somebody says, oh, let me know how I can help, hand them the list and let them decide. And ask them to add to the list themselves or make a list themselves now that they know you a little better. This is an example of the list I use in my research, but you're welcome to use it, but make your own and put your friends to work. Not only does it help you, but we do know that it makes their lives meaningful, and that's really important. And then, of course, your professional organizations. All of these organizations are really important, and remember to tap into all of the resources that they can give you. For example, the AFTD also provides can provide some care support grants, which is extremely helpful to my patients. Here's a question. What are the dangerous risks of not involving a team and having the approach of going it alone when it comes for caring for a family member with FTD? In my experience, and every family is different, but in my experience, the families that have a big team tend to feel less isolated and have more skills to help with dealing with the changes that they see. I do work with a couple families who really do go it alone. These are families that tend to be introverted, and that's their style and they prefer it and they do just fine. But a team will really help you not only support you, but help you identify ways to maximize your quality of life along this path. So in short, very briefly, your needs may change over time. So you may need a physical therapist now, but in 6 months, you may feel like, I think art therapy might be better here, or I need to talk to a social worker. Don't be afraid to advocate. If you're having trouble advocating, reach out to the AFTD and their team, and they can support you. Reach out to your support groups, and they can support you as well. There are online support programs as well. Okay, so we're going to continue the Q&A, but Doug, I think there's one more poll, if I'm not mistaken. How is palliative care different than hospice? Thank you. Hospice is a Medicare benefit that's available to people at the end of the last 6 months of life, and it is and the services are provided for you, so you don't have to pay for them. Palliative care occurs prior to when a person is eligible for hospice. So in order to be in hospice, you have to be eligible. You have to have enough decline to indicate that the person will die within the next 6 months. So palliative care is before that eligibility, where the focus is all about quality of life, comfort care. You're not going to go running back to the ER every time there's a medical health issue. You're going to have the palliative care team help you cope with any challenges within the home. If you're in hospice, sometimes what will happen is a person will improve and the hospice service will need to stop, and then you can go to palliative care. If the person continues to decline, but it's beyond 6 months, it's no big deal. They just recertify you.
The other thing too about palliative care is it's not often used, or we find that there's a cancer diagnosis, for example, or get a diagnosis of heart failure. A lot of times palliative care is kind of automatically sort of part of the care team. In dementia diagnosis, that doesn't necessarily happen, although it probably should. What it is they're part of the team, potentially, who can help navigate as the disease progresses and what your wishes are and where you're at and how to keep you comfortable, and can kind of help us in more holistic approach sometimes than what you get from your sort of more regular medical providers. So sometimes you're on a lot of chronic medications for chronic illnesses and stuff that maybe don't make sense at this point in your life. And the palliative care doctors you can kind of work with them to sort of make make a plan about where you're at and what you need. And they can kind of be a liaison between some of the more medicalized aspects of your care versus what your initial wishes and needs are. So they can be really helpful.
Yeah, this next question makes me wish we had another hour with you. And so I'm going to give it a very quick stab, and then I'm going to ask Maya to chime in. Do you recommend telling the person diagnosed with FTD the diagnosis and explaining the condition? In the work that I do, it depends. I feel a certain ethical obligation that the person with FTD, at least at some point in his or her life, appreciates the fact that this is the diagnosis. But for some people, when memory is part of the issue, and that's not always the case, but when memory is affected, hearing the diagnosis over and over can be a shocking new experience every single time. And that can be very disruptive. So I say, do what is most healthy for your family. And Maya, what would you say?
I would say the same. And FTD, because it's so different in different people, sometimes people they themselves will have a different awareness and insight into their condition. And with people who have more insight, oftentimes it's helpful to know what they are part of their certainly, like, especially people, for example, if you have a primary progressive aphasia, a lot of times you're very aware of the language changes that you're having and understanding what the disease is and the underlying, all of the things, what you can do to get better is really, like, they're on it and they want to know, and they're part of their own care in a way. When sometimes people, for example, with behavioral variant frontotemporal dementia have a lot less awareness into the changes. I agree with Allison. It's good to have it out there, that it's there. But in a way, for you as family members to keep explaining that or trying to get them to understand, oftentimes it's not helpful. It actually won't work. They won't understand. So it actually ends up being frustrating for both of you, I think. So it really depends on the situation and the person and their awareness into their some of the changes that are happening. Yeah.
I think they're going to cut us off here. The other thing that I just want to put a point out there is do what you can to participate in research. And if we can help you identify research options, that can also be a part of your community. And don't hesitate to reach out to us. We're here to answer more questions.
Definitely. Thank you.
Thank you.
For allowing us to be a part of this.
Yeah, definitely.
Thank you so much to both of you. I hope that for all of you in our audience, the framework that Dr. Lindauer and Dr. Lichtenstein have shared offers something you'll be able to put to effective use.